So, hello students, and welcome back to the clinical case discussion of thorax. This is a clinical case discussion number 4. Let us understand this. Come on. A 58 years old man undergoes a coronary artery bypass graft. That is what it is known as CABG. CABG is coronary artery bypass graft. Coronary artery bypass graft, what is that for? If a coronary artery is diseased by atherosclerosis and the lumen becomes very small, the amount of blood which goes to the heart, to that particular chamber or to that particular wall of the thorax becomes less. So the person starts to get symptoms. The person starts to get dyspnea on exertion, like breathlessness on exerting. So this is what we call as angina pectoris, right? Angina pectoris. The lumen becomes small, deposition of fat, atherosclerosis, the amount of blood going to the muscle, to the wall becomes less. The person starts to get dyspnea on exertion, breathlessness on exertion. This is what we call as angina pectoris. We do a stress test. We do a angiography, and we find that the blood vessel is blocked. Now the person is advised to go for a bypass surgery. In the bypass surgery, that diseased artery is removed and is replaced by a graft. Okay, it is replaced by a graft. So this is what we call as the bypass surgery. Bypass surgery. So this is what this person is undergoing, a coronary artery bypass graft using the internal mammary artery. So internal mammary artery is generally selected for this coronary artery bypass graft. Now, post-operative viva. You are asked the following questions. So the artery's anatomical name and its origin. Artery's anatomical name. So what is the artery? It is mentioned here already. So the artery is an internal thoracic artery. Internal thoracic artery, also known as the internal mammary artery, right? Internal thoracic or the internal mammary artery. And this internal thoracic artery is a branch of, can anyone answer this? So that's the first rib. That's the first rib. And what is this artery here? What is this artery here? That's a subclavian artery. This is the subclavian artery. This is a muscle here on the first rib. Can anyone tell me this muscle which is attached to this first rib? On the scalene tubercle of the first rib, this muscle is Scalenus Anterior. Scalenus Anterior. So which is our subclavian artery? Our subclavian artery is this. This is the subclavian artery, and this subclavian artery, as you know, the subclavian artery, that's the arch of aorta. This is the, sorry, I'm so sorry. Okay, what was wrong here? So this is the brachiocephalic trunk. This is the right common carotid. This is the subclavian. This is the common carotid, and that's the left subclavian, right? So the left subclavian artery arises from the arch of aorta. The right subclavian artery arises from the brachiocephalic trunk. Both the subclavian arteries will cross the outer border of the first rib, continue as the axillary artery. The subclavian artery is divided into 3 parts. Yes, this is the first part, that's the second part, that's the third part by the Scalenus anterior muscle. Clear now? The subclavian artery is divided into 3 parts by the Scalenus anterior muscle. So how do you remember the mnemonic for the subclavian artery? What are the branches from the subclavian artery? Just remember, it's vitamin C D. That's the first part, that's the second part, and that's the third part. First, second, and third part. So V is vertebral artery, I is internal thoracic artery, T is thyrocervical trunk, first part, C is costocervical trunk, second part, and D is dorsal scapular artery. Dorsal scapular, that's the third part. Fine. Clear? So from the first part, vertebral, internal thoracic, thyrocervical trunk, second part is costocervical trunk, and third part is dorsal scapular artery. I'm not going to details of subclavian artery, but from the first part of subclavian artery, there's an artery which arises here. This is of importance to us. That's the internal thoracic artery. That's the internal thoracic artery. So this internal thoracic artery is a branch of the first part of the subclavian artery. So that's a subclavian artery. From the first part, this artery is the internal thoracic artery. This internal thoracic artery runs on either sides of the sternum. Correct? At the sixth intercostal space, this internal thoracic artery divides into two terminal branches. Can anyone tell me this? At the sixth intercostal space, the internal thoracic artery divides into two terminal branches. Okay, that's internal thoracic artery divides into, this is the musculophrenic, and this is the superior epigastric artery, right? So internal thoracic artery at the sixth intercostal space, internal thoracic artery at the sixth intercostal space divides into a superior epigastric and a musculophrenic artery. Fine, perfect students. Everything is clear to all of you. So have a look at this. Again, the MCQ, we come to a 58 years old man undergoes a coronary artery bypass graft using the internal mammary artery. So internal mammary artery, internal thoracic artery, the name is the same. The artery is the same. So the artery's anatomical name and origin. So name is internal mammary or internal thoracic artery. Origin is from the first part of subclavian artery. Its relative position to the sternum. It runs on either sides of the sternum. Okay, 1 centimeters on either sides of the sternum, inside the thorax. On either sides, inside the thorax. Its terminal branches and typical level of division. So what are the terminal branches, students? The terminal branches I already mentioned you, the superior epigastric artery and the musculophrenic artery. At what level does it divide? At the sixth intercostal space. At the sixth intercostal space, it divides into these two branches. And name one reason for it. It is a good conduit conceptually. So why is this artery a good conduit? Why is this artery normally selected? Because this artery is consistent. This artery has got a very straight course. It is easily accessible also. So this is the artery which is selected generally for a coronary artery bypass graft. Clear, students? I hope these things are clear to all of you. So have a look at this MCQ and be sure to answer this in the comment box. So internal thoracic artery divides into a musculophrenic and a superior epigastric artery at what space? At about the, what space is that? So if you've understood the MCQ, if you've gone through the MCQ very well, you should be able to answer this. So students, I hope you're getting confidence in approaching the clinical case discussion. This the students find it very difficult, how to approach a clinical question, right? So I hope this is giving you an idea, an insight how to approach the question, and I'm sure you're getting confident. Okay, thank you so much for your patient listening, and be back in the next question, the series of clinical case discussion of thorax. Thank you so much.